Good morning, students. Welcome to my online class. Today, let us continue the topic health and hygiene. Today, let us see what are the preventive measures for COVID-19. So, greet without physical contact. At least you have to maintain 6 feet between two. See this. Maintain physical distance of 6 feet in public places. Whenever you are going to a market or any crowded places, you keep the social distance of 6 feet. Cover nose and mouth while coughing and sneezing. Wear reusable handmade face cover mask at all times. Do not visit crowded places. Avoid mass gatherings. Do not discriminate against people affected by COVID-19, their caregivers, or anyone supporting the fight against COVID-19. Avoid unnecessary travel. If it is really urgent, then only go, otherwise, just avoid. Regularly clean and disinfect frequently touched surfaces. Wash hands frequently and thoroughly with soap and water or use an alcohol based hand sanitizer. Do not chew tobacco, khaini, etc. or spit in public places. Avoid touching eyes, nose and mouth. You can reduce your chances of being infected or spreading COVID-19 by taking some simple precautions. Regularly and thoroughly clean your hands with an alcohol based hand rub or wash them with soap and water. Why? Washing your hands with soap and water or using alcohol based hand rub kills viruses that may be on your hands. Maintain at least 1 meter, 3 feet or 6 feet distance between yourself and others. Why? When someone coughs, sneezes or speaks, they spray small liquid droplets from their nose or mouth which may contain virus. If you are too close, you can breathe in the droplets including the COVID-19 virus if the person has the disease. Avoid going to crowded places. Why? Where people come together in crowds, you are more likely to come into close contact with someone that has COVID-19, and it is more difficult to maintain physical distance of 1 meter or 3 feet. Avoid touching eyes, nose and mouth. Why? Hands touch may surface or can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose or mouth. From there, the virus can enter your body and infect you. So, be careful. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose the used tissue immediately and wash your hands. Why? Droplets spread virus. By following good respiratory hygiene, you protect the people around you from viruses such as cold, flu and COVID-19. Stay home and self-isolate even with minor symptoms such as cough, headache, mild fever until you recover. Have someone bring you supplies. If you need to leave your house, wear a mask to avoid infecting others. Why? Avoiding contact with others will protect them from possible COVID-19 and other viruses. If you have a fever, cough, and difficulty breathing, seek medical attention. But call by telephone in advance if possible and follow the directions of your local health authority. Why? National and local authorities will have the most up to date information on the situation in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help prevent spread of viruses and other infections. Keep up to date on the latest information from trusted sources such as WHO or your local and national health authorities. Why? Local and national authorities are best placed to advise on what people in your area should be doing to protect themselves. Advice on the safe use of alcohol based hand sanitizers. To protect yourself and others against COVID 19, clean your hands frequently and thoroughly. Use alcohol based hand sanitizer or wash your hands with soap and water. So, remember all these points whenever you are using hand sanitizers. As countries are taking strong measures as to contain the spread of COVID 19, self quarantine and the temporary closing of business may affect normal food related practices. Healthy individuals as well as those showing acute respiratory disease symptoms are being requested to stay at home. In some countries, restaurant and takeaway offers are being limited and some fresh items are becoming less available. Good nutrition is crucial for health. Good nutrition is crucial for health, particularly in times when the immune system might need to fight back. Limited access to fresh foods may comprise uh, may compromise opportunities to continue eating a healthy and varied diet. It can also potentially lead to an increased consumption of highly processed foods, which tend to be high in fats, sugars, and salt. Nonetheless, even with few and limited ingredients, one can continue eating a diet that supports good health. So one should remain physically active. To support healthy individuals in staying physically active while at home, WHO has developed specific guidance for periods of quarantine, including tips and examples of home based exercises. Make a plan. Multiple cases of over purchasing have been observed throughout the WHO European region. Panic buying behavior may have negative consequences such as an increase in food prices, overconsumption of food, and an unequal distribution of products. It is therefore important to consider your own needs as well as those of others. Assess what you already have at home and plan your intake. You might feel the need to purchase large amounts of foods, but make sure to consider and utilize what is already in your pantry as well as foods with shorter shelf life. This way you can avoid food waste and allow others to access the food they need. Be strategic about the use of ingredients. Use fresh ingredients and those that have a shorter shelf life first. If fresh products, especially fruits, vegetables, and reduced fat dairy products, continue to be available, prioritize these over non perishables. Frozen fruits and vegetables can also conveniently be used over longer periods of time and often have a similar nutrient profile to fresh foods. To avoid food waste, you may consider freezing any leftovers for another meal. Prepare home cooked meals. This is really very important. During regular daily life, many individuals being at home extended periods, especially without company or with limited activities, can also lead to overeating. Seek guidance through your national food based dietary guidelines on what constitutes healthy portions for adults and be mindful that young children will need smaller portions. So, be aware of your portion size. Just you are keeping staying at home, that doesn't mean that you overeat, so it will increase just your weight, nothing else. Follow safe food handling practices. Keep your hands, kitchen and utensils clean. Separate raw and cooked food, especially raw meat and fresh produce. Cook your food thoroughly. Keep your food at safe temperatures, either below 5 degrees Celsius or above 60 degree, and use safe water and raw material. By using these 5 key recommendations for safer food, you can prevent many common foodborne diseases. Limit your salt intake. You know, people are taking much salt. The availability of fresh foods may decrease and it may therefore become necessary to rely more on canned, frozen, or processed foods. Many of these foods contain high levels of salt. WHO recommends consuming less than 5 gram of salt per day. In order to achieve this, prioritize foods with reduced or no added salt. You may also consider rinsing canned foods such as vegetables and beans to remove some of the excess sodium. Be aware that pickled foods often contain high levels of sodium too. In many countries, 50 to 75% of the salt intake comes from the food we eat rather than what we add ourselves. Given that you might be consuming enough salt already, avoid adding extra salt when cooking and to your meals at the table. Experiment with fresh and dried herbs and spices for added flavor instead. Limit your sugar intake. WHO recommends that ideally less than 5% of total energy intake for adults should come from free sugars, about 6 teaspoons. If you crave something sweet, fresh fruit should always be the priority. Frozen fruits, canned fruits in juice rather than syrup, and dried fruit with no added sugar are also good options. When other dessert options are chosen, ensure that they are low in sugar and consume small portions. Watch out for low fat options as these are often high in added sugars. Limit the amount of sugar or honey added to foods and avoid sweetening your beverages. Stay hydrated. It's really again an important point. Good hydration is crucial for optimal health. Whenever available and safe for consumption, tap water is the healthiest and cheapest drink. It is also the most sustainable as it produces no waste. Compared to bottled water, drinking water instead of sugar sweetened beverages is a simple way to limit your intake of sugar and excess calories. To enhance its taste, fresh and frozen fruits like berries or slices of citrus fruits may be added, as well as cucumber or herbs such as mint, lavender, or rosemary. Avoid drinking large amount of strong coffee, strong tea, and especially caffeinated soft drinks and energy drinks. These may lead to dehydration and can negatively impact your sleeping pattern. Thank you. Have a nice day.